Director of Nutrition at the Federal Ministry of Health and Social Welfare, Ladidi Bako-Aiyegbusi, has emphasized the urgent need for intentional investment in comprehensive nutrition services nationwide. She said such investment has the potential to yield substantial savings of up to $22 million in healthcare treatment costs linked to child malnutrition. Highlighting the preventive impact, Bako-Aiyegbusi noted that prioritizing nutrition could avert over 10 million cases of childhood diarrhea and pneumonia annually, significantly reducing child mortality by approximately 220,000 deaths in Nigeria. Recognizing malnutrition as a critical barrier to children's well-being and long-term economic growth, stakeholders advocate for concerted efforts to address this pressing issue, underscoring its significance for Nigeria's socio-economic development. To discuss this, I'm joined by Chairman, Nutrition Society of Nigeria Lagos Chapter, Collins Akano. Thank you very much, Collins, for giving us your time. Can you quickly give us an overview of the state of child nutrition in Nigeria?
Thank you for having me. Certainly in Nigeria, we face significant challenges when it comes to child nutrition. Currently, according to the Global Hunger Index, Nigeria scores 28.3 in the Global Hunger Index. This simply means that Nigeria is facing serious hunger levels. Now, with this issue at hand, of course, children are most affected. There are about 37 children under 5. According to UNICEF, about 37% of under 5 children are currently stunted. We have 18% of them undergoing wasting, and of course, 29% of them have underweight as well. So all of these statistics goes to show that there is a lack of access to sufficient nutritious food, and further worsens the problem we're currently facing. Yeah.
What role does proper nutrition play in preventing child deaths and improving overall health outcomes in the context of Nigeria's child population?
Okay, nutrition plays a very critical role when it comes to better health outcomes for the entire populace, particularly children. Okay, the child mortality rate currently in Nigeria stands at, I think, about 50 deaths per 1,000 live births. That's a very staggering statistic. You know, these statistics are human beings we're talking about. So addressing malnutrition is definitely crucial for us. And malnourished children are more susceptible to a lot of illnesses and non-communicable diseases, as it were. So we can improve or reduce the mortality rates of these children by fostering adequate nutrition, because in adequate nutrition we can improve their immune functions. We can also help with the cognitive development of these children, and ultimately their physical growth will be affected, and disease risk reduction as well. So I think if we get the nutrition problem right, we'll be increasing overall well-being for children, even in later life.
What specific nutritional interventions during childhood are crucial in, say, mitigating long-term effects and their impact on productivity in adulthood?
Firstly, I would say exclusive breastfeeding. We, the nutrition professionals, we're still having to advocate for exclusive breastfeeding in children from the 0 to about 2 years after delivery. Improving exclusive breastfeeding would be very, very influential in championing nutritional health for children, as laying a foundation. Then we need to also work on the micronutrient supplementation and fortification programs. This has to be large scale, nationwide if it's possible, to help address these deficiencies, especially as it affects cognitive development, because some of the things that the children suffer at the early stage in life affects them even in adulthood. So we need to, champion these. And of course, access to nutritious foods. Looking at the current situation of the country right now with the whole food insecurity and nutrition insecurity also, this is a major challenge. Getting adequate nutrition, even low-cost adequate diets are very, very difficult at this period. So we need to also sustain hygienic practices for these children, because they grab and go. I always tell people that children grab and go, they pick up dirt, and they infect themselves. So we need to work on this for long-term health and for productivity as well.
All right, Collins, thank you very much for speaking with us. We appreciate your time.
Thank you very much.